If you look at that first diagram, that's a study that our team did, and it was funded by HUD, but it was also funded by the Health Foundation of South Florida. And we looked at 250,000 Medicare beneficiaries in Miami-Dade County, and we looked at their neighborhoods in terms of greenness. And we found that the people, and especially in low-income neighborhoods, the people living on blocks with higher levels of greenness had lower levels of disease outcomes. I think that being able to show these disease level reductions is a quantitative measurement that should be added to the other kinds of measurements that people talked about. And then if we take that research, and we're sort of in the policy academia side of it, and we get that information to practitioners who can begin to apply it, then what you see here is Miami's Million Trees program, where anyone in Miami-Dade County can contact the county and say, we need street trees in our neighborhood. But essentially we said there are certain things that are unique to each neighborhood, and getting those right is extremely important. But there are certain overall things, and when you look at sort of transportation and mobility and safety, there are things that need to be provided by the neighborhood, by the site, by the building, and in the unit. So if you look at what's in the unit there, it'll be access to daylight. All habitable spaces have access to daylight. That may sound like a no-brainer to you, but many buildings will have service spaces and things like that that don't, and that's where you create unsafe environments. Issues of safety. This was done for an urban neighborhood. One of the ideas here is that wherever you go, you need to be part of the neighborhood. We didn't talk about this so much today, but sometimes people don't want affordable housing in their neighborhood because they think it looks different. They think it's a different kind of model. But if it fits in the neighborhood and people are proud of it, it works. There's a first movement on it, but between the LIHTC funding and the processes that take place, it's really complicated. So I would submit that sometimes you don't have to go for the whole thing. Sometimes you could make someone's life better at a smaller scale. And so that's where the voices at the table are really important. And they should include people that you may not have thought of, including 10-year-olds who live in the neighborhood.
What does it allow us to do in solving some of the greatest issues that Black women, single heads of household, are facing today to make their families healthy and thriving? We have space. We have land. We have buildings. We have programs. We have a mission. We have a brand. We have things that we can leverage to solve bigger systemic issues, and we believe that space matters. Our approach to housing thinks about her. It's healthy housing for her. And along the lines of building that and those solutions, guess what? There are a bunch of other people that can line up and benefit from it also, right? But I'm thinking about her and her lived experience. So over the next 5 years, YWCA will be building over 500 units of I don't want to say just affordable housing, but accessible housing that is affordable. So that means, thank you very much, we're going to protect affordability. We're going to embed childcare as a part of the response. We are going to make sure that these housing units are also mixed income for social integration as well as for economic inclusion. One of our previous panelists mentioned that, right? That social and economic inclusion has been proven scientifically that it changes the outcomes for generations to come. And it's one of the only things that has been proven to change outcomes. Not to mention, let's be honest, it makes the economics of building these things a little bit better if you have mixed income. Courage, compassion, and commitment are our 3 C's at YWCA. We are a bold mission, and it takes strong leadership and bold mission and risk in order to realize true health into the future.
We were born in the aftermath of Hurricane Andrew, and since then we rehabbed completely free of charge for our service recipients over 1,400 single-family homes, 38 between small businesses and community spaces, and we invested more than $21 million into making Miami-Dade County housing safer, healthier, more accessible, and more affordable, one free repair at a time. Thank you.
Did you say free repair?
Free. So our service recipients do not pay for these repairs. And when I talk about repairs, we're talking about critical repairs for healthy homes. Anything from a new roof to impact windows and doors for older housing stock to make it more resilient in the wake of natural disasters. Then we do a lot of interior repairs, accessible bathroom modifications, kitchen remodeling, HVAC, mold remediation, anything really that we identify in a home that's needed to make that environment safer and healthier for the people living in it. Once a household qualifies for our services, we go out and we assess their property. We go by a list of 25 priorities. So we look for hazards that are present in the home. Hazards like, is the home watertight? Is the roof leaking? Is there mold? Are there, fire or electrical hazards? And then we build a scope of work and a budget. And if funding is available to cover all of the repairs that we identify, we move forward. Otherwise, we take care of the most critical repairs so that the families we're working for have a safer and healthier environment to be in. And those two, there's this misconception, right, in our line of work that good design comes with a very high price tag. That doesn't necessarily need to be the case. But also, if you look at the long-term investment, when you use better materials to build or rebuild, there will be less maintenance costs, maintenance expenses in the long term. Here you'll see another bathroom remodeling. Whenever possible, we do tub conversions to walk-in showers because we do not believe in Peter Pan homes. Peter Pan homes are homes that don't age with us, but we're all getting older. And the vast majority of our service recipients are elderly people or people with mobility issues or disabilities. And another issue that she developed because of the unsavory health conditions and living conditions was asthma. And throughout the 4 years that we were in the home, she reported back that her healthcare-related expenses decreased significantly because we did a mold abatement and we put insulation and a new HVAC system. So we removed that hazard so that she could live a better life.
When people ride by our houses, they don't know they're affordable housing. They think they're market rate housing just like everything else. And yes, that is a part of healthy housing. But there's a whole spectrum from lead and asbestos to deep green housing, and that's where we are right now. So I just want to say that even though some of the things are healthy, are great for the planet, you also have to design for the people that you're serving. And if passive solar or some other design element does not work for them, is culturally irrelevant, skip it. It's okay. And I mentioned that there's a spectrum. You do not have to go deep green on everything, but if you really kind of think about it, you can incorporate accessibility and sustainability in our work. And I say our work because I'm part of this design and development community, and we have to actually demand more, right? 1 in 4 American adults have one disability. That number is only going to grow. But guess what? The federal government, their minimum for accessible housing is 5%. A lot of times, if you just design it right, you're not going to pay more. Or if you pay more, it's just going to be a little bit more. So the difference between a 30-inch wide door and a 36-inch wide door is livability and about $300. It's not that big of an issue, right? So if you have to put light switches on a wall, make them lower, right? Make them chair height. It doesn't cost any more, but we have to demand it and put it in the specs. A lot of affordable housing does not have enough windows because windows equal money. Well, windows also equal health. People need access to the outside. Ventilation is also important, that outside air, designing systems where it can actually get in and be fresh. And again, avoiding materials that have forever chemicals in them. Some of you have heard about PFAS. It's like 4 very long words that I cannot pronounce. But basically, those are the forever chemicals that are in vinyl, that are in the glue in LVP flooring, that are in carpet, that we never see, but are actually, changing the endocrine systems of people who live in these houses. Sustainable housing should not be reserved as luxury housing, right? Race is still the most predictive factor of someone living near contaminated air, water, or soil.